Hello, I'm Dr. Dennis McKenna, as always joined by Dr. Fred Venditti, our hospital system general director. Today is Tuesday, October 13th, giving you the update from Albany Medical Center. All right, Fred, we always start with COVID.
That's right.
We'll start with COVID. Here's the first graph, 8 counties of the capital region. You can see there's currently 31 people in hospitals in those 8 counties being treated for COVID. A slight uptick from last week. Any reaction to that?
Well, Dennis, we continue to track it. It has gone up a little bit in the past couple of weeks, so we're paying a lot of attention to that.
Now, tomorrow we have our regional call.
7:30 tomorrow morning.
A dozen area hospitals, all the way up to the Adirondacks, down to the Catskills, even out west, Fulton and Montgomery County. We'll hear what they're doing.
So we'll hear what they're doing. We'll hear about these numbers that are on this graph, but we'll also hear a little bit more what I'll call color commentary,
right,
in terms of what's happening in their EDs, et cetera.
That's true, because this graph really only represents the people who are admitted. There could be
right.
other activity that they need to tell us about, so we'll find out. So let's talk about this campus here. Next graph. This is Albany Medical Center this morning. You can see we had a little blip up last week. We came down a little bit. We're at 9. So we have 5 on the floor, 4 in the ICU, and one on the ventilator.
Yes.
1 on the ventilator. So we continue to watch that very carefully. If you look at that graph, it really is about 4 months or so where those numbers have sort of been in that range. So,
people have been doing a good job in the capital region, Dennis.
For sure. Fred, I think the New York Times did a whole piece on COVID, and you're a big New York Times reader.
Yeah, I am. So this is the Science Times, comes out on Tuesday, and you can actually see it's a interesting little picture of the virus.
Right.
But this is a section completely devoted to COVID. So all kinds of things are in here. There are updates on the vaccine trials.
Right.
Talk a little bit about the different types of vaccines. There's an article on the back about immunity and all the graphs of how you develop immunity.
Nice.
And as importantly, there's an article in here on getting back to life post-COVID. So highly recommend it if you have an opportunity to pick this up and read some of the articles in here. Very informative.
So to our listeners, I think there was something in there that you wanted to talk about as far as gathering sizes and things of that nature.
Well, actually, Dennis, this has been in the press recently as well. The transmission is kind of shifting. So people are being good about wearing masks out in public and not gathering in big groups. But they're doing things with friends and family. And because I know the family member across the table or the friend, they are letting their guard down. And that's where transmission has been happening lately. So keep doing what you're doing publicly, in terms of in the supermarket and those kinds of things, but be careful with those people that you get together with in small groups. They still could be asymptomatic and infect you.
Okay, very good. Thank you, Fred. Let's update on some non-COVID topics. We've been talking about the search for a chief nursing officer, our CNO search, which was kicked off. Do we have any update on that?
We do, Dennis. We were actually going to interview 6 candidates. We've interviewed the first 2 last week. We have 2 more this week and 2 next week. We're doing it by Zoom, by WebEx, which is kind of interesting. Makes it a little bit harder to do, but the first 2 candidates were really outstanding, and I think we have some good ones coming up.
And the ones who get through the first round, you're going to bring them on campus for interviews here.
So this is the first round. So we're going to interview these 6 by WebEx, and then we'll probably reduce that down to 3 that we'll bring on campus and put them through a multi-day process here on the campus.
All right, a very critical fill for sure. So,
absolutely, it's very, very important executive in our organization.
Speaking of nurses, we always like to use this opportunity to recognize individuals or groups. Last week was Physician Assistant Week. This week is National Emergency Nurses Week. So I've got to recognize that.
Absolutely.
For a couple of reasons, for sure. In fact, I'll be down in the ER later tonight working, so I get a chance to work alongside. And we have amazing nurses all throughout the organization. But I can tell you from personal experience working alongside the emergency room nurses, they're fantastic.
Shout out to them.
For sure. Fred, Election Day is coming up. And there's a messenger which went out today, and it might even be included as a link to this video. And the message is your voice, your vote, November 3rd. What are we trying to tell members of our workforce?
Well, Dennis, we want to encourage them to exercise their right to vote. It's a very, very important civic duty to get out there and and contribute to who is going to lead our country.
And you mentioned there are 3 different ways in which people can vote in New York State.
Right. This is specific to New York State. So first of all, you have had to have registered by the 9th to vote. And then you can ask for an absentee ballot. You can do that all the way up until October 27th. And then it has to be postmarked by Election Day. You can actually vote early. There'll be polling places open. I think there are 5 in Albany County that open on the 24th of October, and they'll be open until the 1st of November. Then obviously you can vote in person on November 3rd.
For sure. That's usually when I go, November, right into the poll. Now, our medical students were very interested in making sure that patients who were in the hospital still had an opportunity to exercise their right to vote. And I know they worked with the dean, and that sounds like a really important initiative that they were behind.
Absolutely. I think they want to make sure that everyone, including our patients, if they're hospitalized, has the right to exercise that civic role, that civic responsibility.
And I think the last thing we'll say about this is, and this is in the messenger as well, is as much as we encourage people to exercise their right to vote, we also want to be sure that the workplace is free of any type of politics, partisanship. So no buttons, no campaign signs. You know, certainly people are free to talk about things if both parties want to do that, but we don't want people walking around advertising. So very good. So important message, Fred. Thank you very much.
So.
Finally, this just came out. This is the first edition of The Story. And there is our number 1 man, Willie Dean. We talked about Willie here before. He is a security officer here who wrote a book called Love. But Fred, this is going to come out quarterly. This is the new way in which we're going to communicate about activities here at Albany Medical Center on a quarterly basis.
The page and the story.
Page and the story.
Some symmetry there.
Right. And so for those who have not had an opportunity to see this, it's really very well done.
It is.
It's very well done.
Very
and there's
professional.
Some great stories, not only about Mr. Dean, but also about a medical student and other members of our workforce. And so I encourage you, please pick up a copy and read it for sure.
Absolutely.
All right. Fred, later in the week, we're going to highlight a couple fundraising activities that are happening on this campus, some important ones that people can get involved in. They can run, they can walk, they can bike. So we'll talk about those on Thursday.
And those are for other entities, not us.
Correct.
Right.
Yeah, so we'll talk about them, but it's American Heart Association would be an example. But we'll talk more about that on Thursday. Good. Anything else to talk about?
I don't think so, Dennis.
Okay.
I think we covered the waterfront today.
All right, very good. All right, so that's it. So we'll be back again on Thursday. We ask that you once again, please take care of yourself, take care of each other, and we'll see you in 2 days.